the definition of a placebo anything that works less than 30% or 20% of the time?
Well, I don't know what the definition of a placebo, but I will tell you this. I think that in modern medicine, this demonization of placebo effect is the most ridiculous thing. We should be harnessing it. We should be harnessing it. Exactly. I can't tell you how many times I've used placebo on purpose. You know, when I was in general surgery, I was part of our surgical rotations. You have to do trauma surgery, you have to do general surgery, different types of surgery. And when we did trauma at Brooke Army Medical Center, a large trauma center, as well as at Baylor in Houston.
BAMC, Brooke Army and Baylor.
Yeah, so I spent a lot of time in both those hospitals. But you know, we'd have a lot of drug addicts that would come through gunshot wounds, knifings, you know, drug deal gone bad, whatever. And while they're in recovery after the surgery, and they may be in the hospital for a month, 2 months, 3 months, these people are going through withdrawals, big time withdrawals, you know, from alcohol, from drugs, whatever. And you, as an intern, as a resident, you make rounds with the senior residents and everything. And as a intern, you make rounds before everybody else does at 5:30 in the morning. And as a first-year resident, you know, you usually go over with the intern to see what all's going on. And I got the reputation among the people that were in the hospital that I would take care of their issue if they had an issue. Well, the reason I got this reputation, you got a guy that's been hooked on drugs for more than half his life. He's in the hospital. He's going through withdrawal. You know, I'm having pain, chest pain. You know, doc, you got to do something for me. And I'd, you know, look, okay, listen, I can get kicked out of my residency program if I do this. All right. And you talk to the nurse, and the nurse already knows what's going on. The nurse, like, she argues, like, no, Dr. Buttar, we can't do this. You know, like, we have to. He really needs this. It's only one time, right? You only, you know, ask for this one. Yeah, doc, just one time. And you'd give him this hit. So it's just really some strong stuff. Okay, this isn't even. This is like way. What is it? It's like, you know, Sufenta. What, you're gonna give me Sufenta? Oh man, that's so good. You know. And then you give him this thing, and they go, oh, I'm feeling better. You know. And you've just given them saline, but the power of belief, they believed there was something, because it's a whole orchestrated, you know, it was like a soap opera we had going on there. You know, like 5 or 6 people were all involved with this. The person felt like you gave them something. They were willing to not perform for you because you did something for them. They thought that you just gave them something that really took care of their addiction, and it was all in the mind. It was just saline. But you made, and you know, that's worked more than half the time it worked. Now, you're telling me that we should say, oh, just write that off? Why? Because you know what? You can give a person a drug and you wouldn't get that kind of effect. We should harness that power. So if we can actually elicit that type of response in an individual, where we can get a benefit in that individual from just the power of belief without changing their physiology, it's our ethical and fiduciary responsibility as healers, as doctors, to harness that power and get that result. Because if we can do so with the least harm, that's the first part of being a doctor, right? Do no harm. Do no harm. And if you give somebody narcotics, you are affecting them in a negative way. You're affecting their liver. There's harm that's being done. So if we can get the same result without giving them a narcotic, why shouldn't we? And why is that poo-pooed? Why is that ridiculed that, oh, you got this result from a placebo? You should get a Nobel Prize if you can elicit a response from a placebo, as far as I'm concerned, at least.
Wow, yeah, that makes total sense. I agree. Because you've done no harm.
Exactly.
And you've potentially healed the patient.